Welcome to Guru Gab Healthcare Excellence through Partnership. If you have ever watched a loved one struggle with a preventable disease or felt frustrated that healthcare only reacts after damage is done, this conversation is for you. Today's partnership between Muniz and GTS Holistic Wellness Center proves that prevention can be measured, scaled, and delivered with the same rigor as treatment when operational excellence meets physician-led innovation. India has world-class physicians and advanced diagnostics, yet invests less than 2% in prevention. Healthcare reacts to disease after damage occurs, rather than detecting biological aging early enough to reverse it. So the question becomes, what if prevention were treated as real medicine measured, physician-led, and scalable? Today, we explore that question through the work of GTS Holistic Wellness Center, India's first physician-led preventive and longevity platform, one that integrates clinical rigor, proprietary science, technology, and operational excellence. I'm honored to welcome Dr. Ravi Kumar Radhakrishnan, founder, clinician scientist, and leader redefining how preventive medicine can be delivered at national scale.
Thanks, Kavita. And I really thank Muniz Healthcare Management Solutions for giving this opportunity and talking about prevention and wellness, which is apparently the hot topic of nowadays, which is a hot topic. So thank you once again for inviting me. Yeah.
Sure, Dr. Ravi. No, Dr. Ravi brings over 2 decades of clinical research and innovation experience to preventive medicine. He is the creator of the Vascular Age Index, a proprietary algorithm that integrates vascular structure, vascular function, and inflammation into a single biological age score. This allows risk to be detected and reversed well before traditional diagnostics would intervene. Under his leadership, GTS has built something rare in healthcare, a physician-governed clinical platform, proprietary assessment and treatment protocols, and a longitudinal outcomes data set spanning more than 10,000 patients. GTS is not just a clinic, it is an end-to-end platform, integrating cardiovascular and musculoskeletal prevention, AI-enabled patient engagement, and standardized operational delivery, built to scale without compromising outcomes. Dr. Ravi, thank you for joining us. To begin our today's conversation, what inspired you to build a physician-led preventive platform, and what continues to motivate you to push this work forward?
Fantastic. Nice question to start off. Basically, an allopath, and a radiologist background. We started, I'm intervention radiologist, that's how it started. And we saw, as when we were seeing patients, and then we saw patients everybody coming at the late stage of the disease. Either there's something wrong that we're not able to identify, or something that is lacking. So that led me to do my PhD. My doctorate was on early atherosclerosis imaging using non-invasive imaging modalities. So where by assessing the early identification process, we can detect 5 to 10 years before the changes that can happen in ECG or echo or treadmill. Even before that, we can identify how the vascular health is. So that made me think that this is what is going to be the future. And then I went for my post-doctoral fellowship, and then I came back, and that's how the whole thing started. So to put it in a short framework, and that's how we started doing the cardiac healthcare basically.
Wonderful. Thank you so much, Dr. Ravi. Now let's open our first topic, the prevention gap and the platform innovation. India invests less than 1.3% of GDP in prevention, and most diagnostic detect diseases only after nearly 70% arterial blockage. GTS takes a very different approach through your triple assessment protocol and vascular age index, which quantify biological aging and track reversal over time. How does this approach fundamentally change prevention compared with the traditional diagnostics? And what outcomes have you observed in real patients?
Yeah. So the key point is to identify what is the biggest gap in modern healthcare. So if you see that we react too late, in the sense we are trying to add years to life. That is what the modern healthcare is looking at. But we treat disease very well. If there's a heart attack, go in, finish it off, and then everything gets over, and then that's how it is. but we fail to identify it early. So there is a prevention gap. So what we have created is a platform, not just a test, or to measure biological age or before disease appears. So before anything can happen, what is that which can alter all these parameters so I can have a good level of time to convert it. That I put it because now cardiac and stroke becomes a major killer disease in India, worldwide, in fact. So that is where I brought in the triple assessment method, where we take biomarkers, blood test, functional aging, and structural vascular aging, and combine together. Then we give it as a report called the vascular age or vascular age index to make it understandable. So for a common man to understand. So if a 45-year-old man walks for a routine healthcare to any other labs, they get a series of blood tests done. And when he goes and meets the doctor looks for any changes, is it there or no. But what in GTS we do is when the vascular age assessment comes, and that is where, suppose if I say a 45-year-old man comes here to my clinic and I say, boss, his vascular age is around 60, and that gap gives me an opportunity. So, and why this is important is because biological aging is not fixed. It is very early and it is easily reversible. And in fact, the future of health care is measurable, modifiable, and manageable. Trust me, that is how it's going to happen. So that was the thing where the value of triple assessment came, and that is how we introduced and started off in GTS.
Okay, got it. I think that shift from detecting disease to reversing biological aging with the measurable outcomes is exactly what makes this approach transformational. Thank you so much, Dr. Ravi. Our next topic, clinical rigor and operational excellence. Innovation alone does not scale healthcare. Execution does. So GTS has locked clinical SOPs, centralized quality assurance, and implemented preventive scheduling and workforce models to ensure consistency across sites. Where have you been unwilling to compromise as GTS scales, and how do you balance clinical innovation with operational discipline?
Right, fantastic question, because this what happened during my initial phases of starting my clinic it was all in a way because I was trying to see how to fit in things, because there's no protocol available in the world. So I have to create something which is unique and trustable, and it is reproducible. So in that whole process, then I said, yes, I'm willing to accept certain things, but certain three things we are absolutely unwilling to compromise. One is the clinical integrity. Every protocol, therapeutic, must be measurable, evidence-based, and outcome tracked. So that is one of the major things which I thought we should not compromise on. The second is standardization, at the same time without loss of personalization. That means, in the sense, the protocols, the blood test, assessment part can be standardized. But when you start intervening, that has to have a personal touch as far as wellness is concerned, because each patient has to be personalized wellness program has to be given. So this is the second thing which I thought should not be compromised. And the third is the data discipline. So every patient journey, feeds back into scores, dashboards, and longitudinal tracking. This in turn becomes a clinical care into a learning system. So these three things I thought we should not compromise on. But whereas you need to balance innovation and operation to some kind of thing, and that is where a great clinic and a scalable platform can be created.
Yeah, that's great, Dr. Ravi. Can't agree more. Standardization, I take just standalone as a protection, not constraint. That's the foundation for scaling medicine with integrity. I agree. So this is our critical integration topic, the last question, technology, data, and patient engagement. GTS also integrates AI-driven adherence nudges, predictive risk scoring, and remote monitoring dashboards. How does technology enhance, not replace, physician-led care? And where do you see the greatest opportunity for digital expansion in preventive medicine?
Perfect. Because now, as you know, because AI is being spoken of, and people have heard that AI will replace doctors and things like that. But as you rightly said, technology should, or I would say cannot replace physician, but it should rather extend the physician's reach and consistency. That's where technology will help us out a lot, especially in prevention wellness. The real challenge is not in decision making at all. The real challenge comes in early detection, longitudinal tracking, and pattern recognition. in
Mhm.
this three, that is where your technology excels. So, and GTS, there's something like an upstream event and downstream event. So upstream is where the automating assessments and integrating imaging, biomarkers, everything comes into, and creating vascular scores becomes an upstream kind of a development. But whereas the downstream part, the physician remains central,
Mhm.
interpreting risk, contextualizing data, and designing personalized interventions. So, in fact, to put it in short, technology will remove noise, physician provides judgment. So, this is how I like to put it as. So, the future
Yeah.
of wellness isn't human versus machine, it's clinician guided intelligence at scale.
Yep, perfect. Yes, that's right. Perfect, wonderful. And I mean, technology is extending physicians, not replacing them overall.
Exactly.
Turning prevention into a continuous improving learning system across whatever the three pillars, what you explain, it becomes as a continuous improving learning system. Okay, Dr. Ravi, let's close our conversation with a wrap up question.
Okay.
As healthcare increasingly moves toward outcome based models and national platforms, what is the single mindset shift physician led organizations must adapt to lead the next era of preventive and longevity medicine?
I feel prevention aspects should be brought into the regular medical school curriculum, because as of now it is not. So our mindset is always been, you wait for an event and you treat the event, but it's not on prevention. So prevention and longevity medicine requires us to track the biological decline early. So this means we have to think of scores time and not isolated labs or episodic values and say, boss, this is that, and I say one patient here, one patient there. It should never be like that. So physician-led organizations that adopt this mindset and don't just deliver care, they build longitudinal health relationship. This is what the GPs were doing actually. We say the general practitioners were already doing this, but they stopped at one level because the super specialty people came and took it over. But now this prevention and wellness, rather than going into now it is all becoming, it is run by different sectors. The prevention model is not physician driven. And once this is made as a physician driven model, that will have more value and we can prevent many diseases much more early. And this is what I think will be the single mindset shift, that the physician should be ready to accept this.
Yeah, wonderful. Thanks, Dr. Ravi. From what I understand is from episodes of care to lifelong outcomes. That's the mindset shift that transforms prevention into platform scale medicine. Just to summarize, and also thank you very much, Dr. Ravi. Here is the summary of key takeaways from today's conversation for the audience. Number one, prevention works when biological aging is measured early and outcome are quantified, not after disease manifests. The second, physician-led governance with operational discipline scales innovation without compromising clinical integrity. The third one is national impact requires treating prevention as real medicine, measured, standardized, physician-led, and technology-enabled. This is how prevention moves from aspiration to reality when clinical innovation meets execution discipline. If you are a healthcare leader, this is for the audience. If you are a healthcare leader, physician, or entrepreneur asking how to scale preventive medicine without compromising outcomes, the GTS Muniz partnership model we have discussed today is your roadmap. The question isn't whether prevention works, it's whether we are ready to operationalize it. Thank you again for joining us today. Let's continue this conversation because the future of healthcare isn't just about treating disease, it's about preventing it before it starts.